I've got the internet's top 20 questions on growth scan. And if you are a regular on the channel, you know that I try to get these 20 questions done in 5 minutes to get you the information that you need in a short amount of time. So let's start the timer now and let's go. What is the difference between a growth scan and an anatomy or anomaly scan? So a growth scan is really looking for the baby's growth. Is the baby small? Smaller than they should be, larger than they should be? Is the baby head down? Really looking mostly for the growth of the baby. And an anatomy scan is more looking at all of the baby's anatomy, How is a growth scan done? So a growth scan is done using an ultrasound, and it's done by a sonographer. What does a growth scan show? So a growth scan can show if the baby is smaller than expected, if the baby is larger than expected, if there is a problem with the amniotic fluid. It'll also show the baby's position inside the womb. Is the baby head down or breech? And also you can look at the blood flow between the placenta and the baby as well during a growth scan. Are growth scans accurate? So it is hard to get an accurate measurement during those late term ultrasounds. And that is one reason why these ultrasounds, these growth scans are not routine procedures for everybody. Are growth scans normal? So growth scans are normally recommended if there are concerns for baby size. Are growth scans common? Growth scans are common when there are concerns for baby size. They aren't common for just routine care. Are growth scans in 3D? No, usually growth scans are not done in 3D. Are growth scans covered by insurance? So that is a very tricky question. Insurances just vary so greatly from person to person and country that there really isn't an answer that I can give for this. I would say sometimes maybe not. If there is a shown medical need, I would say more likely to be covered by insurance. Is a growth scan mandatory? So growth scans and any other procedures are really what it boils down to is you have informed consent, and you have, with shared decision making, you have the right to choose whether or not that is something that you want to take part in. So it's definitely something to have a conversation with your doctor about. Can growth scan measurements be wrong? Absolutely. What to expect in the growth scan? So with a growth scan, you're likely to see measure the baby's head, the circumference of the head, the circumference of their stomach, and also the length of their femur. Those are three main measurements that are taken during a growth scan. Can growth scan change your due date? So unlike a dating ultrasound that you might have earlier in your pregnancy, growth scans don't change your due date. Now they might lead to the decision of an induction, which would change when you're going to have the baby, but not your estimated due date. Can you request a growth scan? So you can request an ultrasound or a growth scan at any time, but it doesn't mean that your request is granted. That's really up to your care provider and whether they think that it's a recommended procedure for you. Growth scans can be done in which week? So they are usually done during the 3rd trimester. How many growth scans will you have? That really depends on if there's a concern or something that they need to keep a watch on, whether they'll bring you back in for multiple scans. How many growth scans in the 3rd trimester? So same idea, during that 3rd trimester, you might have more than one growth scan, or if there's a particular issue that your doctor is following that they would like to keep track. How many growth scans do you get? So it's really only if they either suspect a problem or are following something. Growth scans are not routine in most practices. Most practices don't just routinely do a growth scan. Now some do. Which week is best for the growth scan? So they're commonly done in around 36 weeks. Some providers do it at 38 weeks. Is the growth scan internal or external? So the growth scan is an external ultrasound. It's going to be done right on your belly. It is not going to be an internal ultrasound that you might have had in your earlier pregnancy. And difference between the growth scan and the biophysical profile, or the BPP. So growth scan is measuring sizes, and a biophysical profile is really looking at how the baby is doing, what's their heart rate, their movements. So size cannot be determined from a biophysical profile or even estimated. Size is going to be on the growth scan. Whew, okay, that was super fast. If you love getting your information in this quick rapid fire style, then check out this playlist right here. We have water breaking, Pitocin, I mean, so many that I know you're going to want to see. And I'll see you guys next time. Bye.